I like the idea of really doing a bit of a check-in with self on a scale of 1 to 10. 1 is I'm super depressed or I'm super anxious. 10 is I'm completely at peace, I'm completely calm, I'm completely fulfilled. Where are you falling on that 1 to 10 scale before opening up the app? And where are you falling when you're midway through, let's say, the 20-minute block of time? And where are you at the end of it?
Hmm.
Unfortunately, what we're finding is that folks are walking away feeling less connected, less recharged, less purposeful, less positively about their lives and their circumstances when they're leaving social media, and more isolated. So it's serving the opposite effect.
Hello, my friend. Welcome to Something for Everybody. My name is Aaron Machbitz. Dr. Josh, welcome to the show.
Thank you so much for having me, Aaron. It's an honor to be here.
I'm excited to talk to you about my favorite subject, mental health. And as you're an expert in that area, I'm excited to pick your brain on a few things that I've just been sort of been thinking about. And I think you can help me maybe get an answer or figure out which is best. But before we do all that, I have a very important question to ask you. And that is, how are you doing? Like, really, how are you doing?
Well, thank you for asking. I am doing well. It's so interesting. As soon as you said we have an expert in mental health, there's something about the expert word that as soon as you said it, I was like, oh shit, he's got the wrong guy. That fraudulent stuff kind of creeps in. That feeling of, am I good enough? It's so interesting how primitive some of that wiring is, some of that language is. So it's so and I've been doing this work for many years. I've been in my own work for many years, and it's really still so striking how insidious that belief of I'm not good enough, he's got the wrong guy can be. So as you're introducing me and as I'm listening to my own inner monologue, it's really cool to kind of notice and be present with those emotions and that experience. But I'm doing really well. It's such an honor to be here and talk about a topic that is so near and dear to my heart as well.
Yeah, that brings up a lot of thoughts in my brain about what you're talking about because I mostly work with athletes. And
Mhm.
we have a saying with athletes that, and I think probably with most people could adopt this saying, but it's like, you're never too good to get better.
Right.
And that's on like one side of the bridge. On the other side of the bridge is sort of what you're talking about, that you think even after all of this stuff that you've done, like this real credible thing that you can grip onto that you've actually done, and you still sort of think, am I not good enough yet?
I have that
And
experience whenever I'm meeting a new person, whenever I'm meeting a new patient for the first time, and I'm scared of not having that experience because it keeps me interested. It keeps me
mm,
engaged. In some ways, it keeps me on my toes, not in an anxiety producing way, but in a curiosity engendering way. I'm genuinely curious about novel experiences, and I'm scared of not being curious any longer, of not being kind of on my toes, because we're talking about really important stuff, so nervousness, that sense of angst, that sense of apprehension, I've learned to reframe in time into a sense of excitement, right?
yeah, you feel like it gives you your edge,
Exactly.
and I I think about that in regards to like self-talk because with athletes, a lot of times the ones who reach the highest levels have this brutal self talk. Everything is demeaning and critical. But in one sense, if they have a bad game, they're like, hey, dude, you freaking suck. You need to get into the
Mm,
batting cages. And so it pushes them to go work in the batting cages. And then now, with all this stuff around mental performance and mental skills and mental health, they're like, there's a different way you can go about it and still have your edge. But a lot of these athletes are scared because they're like, well, is my drive going to go away? Is my
right.
determination going to go away? Like, what's going to happen if I actually start talking to myself maybe a little bit more compassionately with still having that edge about you? And I think that's such an
Mhm.
important distinction, like just for anyone to make, because we're all just trying to do the best that we can.
That's all we can do.
But I was thinking about something before we popped on. It being May when we're recording this, so it's Mental Health Awareness Month, and the conversation around mental health, even just over the last couple years, has completely changed and altered and grown, and that's wonderful. But I
Hmm.
think one part of the conversation that hasn't been getting touched on enough is the people like you who are actually in the trenches trying to get people to their healthiest, best versions.
Yeah.
And so my question is like, what do you think people get wrong or don't notice or just don't realize about actually holding all of these people's pain and problems and then having to also deal with your own life and potentially kids and romantic partners and just like
Hmm.
things like that?
That's a fabulous question. I think, it's people will say to me, "Do you take the content of sessions home with you? Do you ruminate? Do you?" And the truth is I really don't. I feel like over the years, whether it's conscious or otherwise, I've gotten pretty skillful at being able to leave stuff at the office. But that's the conscious material that I'm leaving at the office. There's a whole well of subconscious, unspoken material, my compassion fatigue, taking a look at that. How burnt out am I for other intimate relationships in my life? Am I snappy with my toddler at home when he hasn't, promptly put away his toys? Is that a function of not taking enough care of myself during the day? Have I seen too many patients in a given week? Um, I think, unfortunately, the mental health professional, and I'm a licensed psychologist, there's really still in 2023 such a taboo tone of receiving mental health support for mental health professionals. There really just is. We claim that there isn't. We claim there's such a taboo tone. And within certain licensing boards, there can sometimes be a very kind of crude and punitive role that these licensing boards might serve if they were to find out, for example, that a licensee has a history of mental health or substance use disturbances in their past.
Mm.
And I feel very strongly that most great therapists themselves have navigated through their own shit, right? It's hard to show up and be a conduit for meaningful change if you haven't gone through and hopefully overcome or be in the process of overcoming that strife and that struggle. So I think the hardest part for me is that kind of unspoken material peeping through my own compassion fatigue, bubbling to the surface, and not always really being clear of when enough is enough professionally until it's too late. Because it's not like I can say, well, I've seen 30 patients and therefore I'm done. Sometimes I can be fried after seeing 25 patients. Sometimes I can see 43 patients and be ready to see five more. So it's not so much the content as much as it is the culmination of everything and what's happening internally with me. And sometimes that's hard to pinpoint in real time.
Mm. Do you do you think there's a bit of potentially shame built in a licensed professional feeling like they need also to see a licensed professional because if they themselves need help, how can they be someone who can help someone else? Because that's
Yes.
obviously a very logical thought pattern that someone might have.
Yes, it is, and yet I would never want to go to a personal trainer who hasn't hit the gym before. I would never
Mhm.
want to watch a Broadway actor who hasn't themselves sat front row at a Broadway show. I wouldn't want to be courtside at a Lakers game watching professional basketball players play if they've never been to a game themselves. There's a nuance and a rhythm that takes place only if we're on the recipient end sometimes, right? It's hard to be expert if we haven't benefited from expertise, and therefore if we haven't struggled in some way. So I think, unfortunately, there's not enough emphasis on the importance and prioritization of personal struggle. We all have it, but there does seem to exist this shamefulness in the licensed mental health profession surrounding receiving mental health services. It's not something that's ever stated overtly, but it does feel like there's this taboo tone. And I really want to change that.
Yeah, I completely agree, and I see it with with coaches, right? Because
Hmm.
there's now an emphasis on athlete mental health, which is fantastic and beautiful. But you also have to look at the person who's serving these people. Like if I'm not at my best and I'm feeling tired, fatigued, overwhelmed, anxious, stressed, and I go and I talk to my team, which is 14-year-olds, they're gonna receive that version of me, which is not the best
Right.
version of me. It's like the same way you want to line up your words and your actions, right? If I'm telling
Mm.
my clients or my teammates to do these things, to have a breathing practice or journal or meditate or make sure you get enough sleep and all of these great things that you can do, and I do none of those things, then it doesn't line up that way. Maybe just
Right.
one, because I feel like I don't have time potentially. If you're seeing 30, 40 clients in a week, I understand that. And then you want some personal
Hmm.
time, you want to spend time with your kid. But there has to be this, I can't say balance because that doesn't exist, but maybe this, I don't even know the right
Rhythm.
word. Yeah, rhythm. Yes. Yeah, that we can apply, that the people who are doing the helping also can have the help. And it's just like this big support organism that
Yeah.
allows for uh, people to flourish in the best way they
Right.
possibly can.
I remember being so well said. I remember being a student in graduate school, and the program that I attended, they did not require students to be in their own analysis, their own therapy. And I don't know the legalities associated with that, but there are programs that do. And I think it's really unfortunate when a therapist who's treating cases has not undergone their own work. And you can tell the difference. You really just can, in terms of sitting across the room from someone who's never undergone their own psychological work but is in the zone of expert. And it doesn't mean that they don't have beneficial things to offer. I'm not saying that
Right.
everyone has to have a history of pronounced trauma in order to be able to be effective. But what we know is that the toughest experiences make us who we are. We
Mm.
grow through the painful grit, and overcoming that is what makes us capable of offering healing support. So I really am aligned with everything that you're describing. I'm so on the same page. I think we have to create a safer space for the helpers getting help.
Yes, because if we're going to advocate for better access to mental health care, which is great, trying to reduce any of the barriers that might exist, which there's a lot of them, and good people are doing really good work, then, and more people are seeking those treatments, awesome. But if the number
Right,
of mental health professionals keeps going down, then what are we meant to do? Then all this
right,
work we're doing to decrease the barriers has no effect because people can't see anyone. And I can't imagine having to see that many patients in a week.
mhm,
And then it becomes like sort of like you're reducing the amount of time for clients. You don't get to do your notes in between. You don't even get to take a snack in between or a nap or
right,
go for a walk because you're just trying to churn all these things out. And that's not beneficial for anyone. So I think,
right.
yeah, so that's just what I've been, I don't know, thinking about that and figured you had some insight in
Well, thank you.
it. But I was also thinking about just current trends in mental health.
Mhm,
What are the trends that you're noticing, maybe in an upward spiral and sort of in a downward spiral?
mhm. Well, I think COVID did a number on us. It's still doing a number on us. We're spending more time on social media than ever before. And ironically, we are less socially interactive than we've ever been before. Kind of doesn't make sense to me. So, we're seeing an onslaught of symptoms of depression, anxiety, particularly in adolescents. We're seeing more completed suicides, unfortunately. So, the means through which suicidal plans are being carried out tend to be more lethal, whether they be carried out regardless of which gender they're being carried out by. So those are really unfortunate phenomenon. We are seeing greater surges of awareness for mental
Hmm.
health issues and difficulties. There's a lot more conversation and dialogue around mental health disturbances and also supports than ever before. It's not that our rates of mental illness are that significantly more prevalent than they were 30, 40 years ago. There is some slight increase, but our rates of exposure openness, vulnerability, and comfort in talking about these themes has amplified exponentially. So that's a really good sign. We're talking about what's uncomfortable.
Yes, we are very much so, and I think on the other side of that coin is this beast of social media, right?
Mm-hmm.
I can't demonize the thing. I use social media every single day, so that would be very hypocritical of me. But if we can look at it sort of in a dynamic way where it has good parts and bad parts, I think potentially one of the parts that has been not so good is that yes, more people are talking about mental health, but I think then it's sort of caused people to self-diagnose some things that might
Mm-hmm.
not be potentially all the way true or factual
Yeah,
or real. And especially with adolescents, they have this just like we all do, but I think it's a little deeper in adolescence. They have a deep sense of belonging, like they just want to
right,
fit in. That's all I
right,
wanted as a young boy. I just wanted people
right,
to. I wanted a group. And so, if
right,
all of my friends are anxious, or all of my friends are depressed, or potentially self-harming, like I might partake in that, even though that might
right.
not be my real feelings. So I think that's very complicated too.
It's true. Not every ex partner is a diagnosable clinical narcissist. In fact, the rates of narcissism are very low. Clinical narcissism is present in around less than 1% of the population. And if we were to go on social media feed at any moment's notice, it's suggesting that 40% of people are. How many times have we heard the buzzwords gaslighting, right? I mean, that is something that I've heard more than ever before. And in some ways, I think you're right. Trauma response is another one. It kind of waters down the significance of these very real conditions, experiences, symptoms, and it creates confusion, right?
Tons of confusion. It's like I was already confused as a 13-year-old boy. Like I'm growing, I'm
Right,
changing, I'm moving. I like this, I
right,
like that. Should I like this? Should I like that? Am I going to fit in? Oh my God.
right.
And then, and now kids have this thing they can look at perfect people on the internet. I don't look like that. My body is icky. Should I like this? Like so much stuff. And then on the fact that all of
Yeah.
these things are happening. So we can't understate one, how capable these young people are just to be able to keep moving and adapting,
Mm,
but also how can we try and understand them a little bit better to help them, because none of these
right.
things are going away, so we can't say stop using social media. That's just not a it's not a fact.
Mm-hmm.
It's not going to happen.
Mm-hmm.
But we can try and, I don't know, set some emotional parameters, figure out why
Yes.
they might want to use it and things like that. What do you think?
I tend to agree. My concern isn't so much that kids are going to be confused. It's more so that kids will be overly comforted. And I'll tell you what I mean. We tend to think it's a really bad thing for children to be confused. They'll be confused about sort of gender diversity, or they'll be confused by material on social media. I mean, when you think about the subjects that children have been learning in grade school, whether it's trigonometry or advanced calculus, I mean, kids are frequently confused, befuddled, and have the capacity to kind of work through that. My concern with social media is that it provides an instantaneous source of relief and comfort. Now, it's not long lasting, the comfort. In fact, it only lasts for however long a given scroll takes place for, and it's a matter of milliseconds sometimes. But children are being deprived of discomfort, and discomfort is a really important source of social learning. It's also really an important function of self empowerment and self efficacy, right? So when we're comfortable all the time, when we have company in the form of social media all the time, we lose out of the ability to engage in healthy risk taking. We lose out of the ability to be more vulnerable. And we also lose out on understanding what it means to just be experiencing unpleasant emotions. We have
Mhm.
more than ever lower rates of tolerating distressing emotions as a society. We are so uncomfortable with discomfort, and we have all the creature comforts in the world. I look at that as a concern.
Absolutely, absolutely a concern. What advice would you give maybe a teacher or parent? who's struggling with this right now?
I really think having time limits are critical. Abiding by specific time constraints for perusing social media is so important. And I would recommend that they not just be age related, but related to the given condition or headspace of the person who's on social media. So a 14-year-old girl or child who's struggling with body image issues, which is like every 14-year-old I know, should not be spending hours on social media perusing through different body exposed related accounts. That should not be the focus. Having a 20-minute block of time where there's a specific purpose for going on social media makes a huge difference. If we walk into the grocery store and we don't have a grocery list, we're just really hungry. We're going to buy things we don't want. We're going to spend money we don't have. And we're going to come home and realize, oh crap, I forgot the paper towels. I forgot the orange juice. I forgot the peanut butter, whatever. And when we walk onto social media without a function, a clear cut intention, and when we're emotionally starved and deprived, we tend to leave feeling even more depleted. We're not feeling recharged at all. I think social media is brilliant. And if we can utilize it in functional ways, it can be a fabulous educational opportunity. But right now, we're turning to it for way more than it's intended to provide.
Yeah, I mean, I can't tell you the amount of things people I've connected with through social media. Me and you,
Right,
right? I found your
right.
Instagram, your beautiful Instagram that everyone should go follow. And like, I
Thank
want
you.
to have a conversation with that person, that man, that like, how do I learn from him? Right. That's the beauty of it all. But what you're saying is perfect, right? Having this clear intention about why you're opening said app.
Right.
So is there more concrete advice you can give someone on how to maybe set an intention for sort of
Yeah.
anything they're doing, or specifically social media?
I like the idea of really doing a bit of a check in with self on a scale of 1 to 10. One is I'm super depressed or I'm super anxious. 10 is I'm completely at peace. I'm completely calm. I'm completely fulfilled. Where are you falling on that 1 to 10 scale before opening up the app? And where are you falling when you're midway through, let's say, the 20-minute block of time? And where are you at the end of it?
Hmm.
Unfortunately, what we're finding is that folks are walking away feeling less connected, less recharged, less purposeful, less positively about their lives and their circumstances when they're leaving social media, and more isolated. So it's serving the opposite effect. And I really, myself included, have tried to be more diligent and decisive about the accounts that I'm following, about the media that I'm perusing. And I have set check in times throughout the week where I'll go to certain websites or news publications and get my news for the week. So I tend to be the last person to know. The reason being is I don't want to be bombarded with tidbits information about the world. I feel like if it's really that important, my husband will call me or they'll like announce something on the intercom of my building. But other than that, I don't want to be bombarded or surprised. I leave the surprises for Netflix and Hulu. So I think we've just got to be more intentional and time limited.
Yeah, intentional and time limited. That's good. That's a great place to start. Yeah, because like it's so funny. I think like we check in with ourselves at sort of random moments. Like we'll go to a movie or we'll watch a Netflix show and we check in about that. Did I like it? Would I watch it? Would I recommend it to a friend? We have all this laundry list of things about this like not very important thing that we just did. But like in a lot of this important things we do, like I just had coffee with a friend. Okay, how did that friend make me feel? Is that energy
Right.
giving or energy taking? Social media, is that energy giving or energy taking? How can I reflect on this a little bit deeper on the more important parts of my life so I can stay energized for the day and for the things I really care about? But I'll do that for the Outer Banks Netflix show, but not for this
Exactly.
relationship that takes up like a lot of my time.
Exactly. It's kind of ironic. We can change that though.
Yes, absolutely. Absolutely, we can just by having a conversation about it and introducing it to a person and seeing how they feel. And they like it and they introduce it to another person. And then there's this downstream effect of positive things, which is really,
Hmm.
what a podcast or a social media post is for, right? So
Right,
one person sees it and it snowballs into a bunch of other great things. But
right. The other thing that's important for parents who may be listening is that it's really critical to be protective about having certain parameters for your children around time spent on social media, really knowing what accounts your kids are following. It's crucial in the same way that we wouldn't put a drug on a counter in front of our child and say, use it wisely, hope for the best, be exploratory, it's par for the course of, there's certain boundaries and parameters. And in a lot of ways, cocaine and Instagram are a lot more alike than cocaine and other illicit substances in terms of the effect that it produces on our brain. And arguably, social media can be just as hazardous for brain development as illicit substances. So I think we know it's bad for us. I don't think we realize, most of us, the gravity that it can have on brain development, on fostering aggression, especially for adolescent boys. But I shouldn't be so gender focused because it can be, cross applicable. Parents can really do a better job of really being mindful and attuned to watching what accounts their kids are following and doing a better job of modeling for their children healthier social media and just electronic practices in general.
yes, yes, the role model there is extremely important because kids, like I very much learned from coaching them, is that they don't really care what I say, they care what I do.
Right.
Um, and what you do, they're always watching and they're so smart and they are going to adapt to
Sponges.
that and they're just soaking it all in and they're going to do the same thing. I learned this lesson very valuably um, coaching baseball because I would think to myself, okay, I'm telling my kids to be calm and collected. Okay, you made a mistake. So what? Doesn't matter. But then I grab my hat, I throw it on the ground, and I stomp on it. But I'm
Right.
saying the right words, but my actions don't even follow that whatsoever. And then my kid comes to the plate. He bats. He strikes out on 3 pitches and he throws his helmet in the dugout. I'm like, what are you doing? Why would you throw your stuff? You never throw your stuff. And then he goes home, gets a bad grade on his test, and yells at his mom. None of that, none of those, the mom, the test, the baseball don't seem to be related. But someone he looks up to, his role model, his coach, is throwing his hat, is slamming his stuff, and being aggressive when his words don't line up with that. So it all matches
Right.
up. And I'm not saying that being a parent or a coach or anything who is in front of kids a lot is easy. It's extremely hard.
No.
Like it's the hardest thing you can do, but also has such a deep honor to be able to shape these young people's lives. And so
Beyond.
we just have to be cognizant of that, of how we act in these situations and how we want them to act. And when we don't act up or hold ourselves accountable, how can we sincerely apologize and teach that sort of self and self forgiveness and forgiving others and like learning these skills early on to be able to adapt to the sort of the harder things that come in their life.
That's really well said. Yes.
Because it's like you're one of your big things, right, is feeling all of your emotions.
Mm.
So how can we get young people to understand that when they feel overwhelmed or they feel stressed or they get heartbroken or
Mm.
they feel like they just can't handle this, how can we teach them that it will be okay, like they can handle it?
Mhm.
What some of skills that you might be teaching these people that you work with?
I think a lot of it is modeling. It starts with parents first, acknowledging and accepting non judgmentally all of our emotional experiences. We cannot, unfortunately, selectively annihilate certain emotions. We can't say, yes, joy, yes, hope, but screw you, fear, screw you, sadness. It's a one stop shop, and it really is a buffet line. So, we can't selectively experience a given feeling. We either feel them all or we feel none of them. So when we annihilate the pain, we also annihilate the joy and the exhilaration. So I think it's about really modeling the practice of embracing and accepting in a non judgmental way all of our emotions, talking as parents about when we're feeling sad, when we're feeling anxious, when we're feeling anger. That's really, really critical. I encourage folks to develop a mindfulness practice, whether it's 5 minutes of deep breathing, where we're bringing our attention back to our breath, whether it's journaling for 5 minutes every single day, just exactly how we're feeling in a given moment, whether it's doing a sensory exercise where we're noticing, 5 things that are green in our immediate environment. Priming ourselves to be in the present helps us to scientifically helps us to be more attuned with and in consort with a given emotional experience.
Yeah. Because if I can feel that I'm sad today, I don't know why, you know, I'm just feeling that way, and I can relay that to my kid, but show them that I'm still doing the things that I need to do, that I'm still showing up for them, I'm still showing up for myself, but I'm feeling a little off today. And that's okay, right?
Mm,
There's nothing wrong with you. You're just a human being experiencing different things. And
hmm.
I think that that's important, and especially for young boys, the anger one is challenging. But just like you said, not to
Right,
say that no one else feels anger. Obviously, everyone feels anger, but
right.
it's a complicated one because it can just boil over into some really, really, really not good things. And
Yeah,
so
you're
trying to
right.
just figure that out early. Like, okay, yes, you feel
Yes.
anger, you feel it. What does that mean? Why? What can you do about it that's safe for you and the
Hmm.
people around you?
Right.
And things like that.
Look, I tell folks all the time every single feeling has three things in common with another feeling. And those three things are there's a beginning, there's a middle, and there's an end,
Mm,
right? All feelings will pass. And part of modeling a healthier framework and a relationship with a negative emotion, quote unquote, like doubt or fear or anger or regret or shame, involves having a bit less of a hold on positive emotion. So it's great that you're feeling happy. Let's move on. It's got to feel upsetting that you're feeling anxious. Let's move on. Let's kind of embrace it and also move on. So we have to be universal in our practice. We can't latch on to the positive, and dismiss or omit the negative. We have to kind of be a bit more passive and less engaged, right? Noticing in a non judgmental way with a tone of compassion, but also passivity, right? We don't have to be in the trenches of every single one of our emotional experiences, even the positive ones, because they're all going to pass. That's the good
mm,
news.
yeah. This too shall pass. This too shall pass.
Yes.
How
Yes.
how do you work with people who strongly identify with the emotion that they feel? They feel like that thing that's who they are. It's consumed them instead of something that's just maybe part of them and that will pass.
Mhm. Well, I think it's actually avoidance of an emotional experience to identify completely with a given emotion. If I identify myself as being an angry person, I'm actually avoiding the sensation of what it means to be angry.
Huh.
It's the same coin, just a different side. It's like in a relationship, if we're too enmeshed with a partner or if we're disengaged, both of those are patterns of emotional or intimacy avoidance. So when someone is so fused with an emotion, it's actually an indication that they're having a very hard time sitting with it. It's safer to become it than it is to experience it. So I would want to learn a little bit more about their history with that emotion. As an example, what did anger look like within their family of
Mm.
origin? How is anger metabolized, expressed? Were they scared when a parent or caretaking figure exhibited anger? And I would want to create a little bit more of a familiar framework with all emotions, not just anger. So when we're too tethered to something, it actually implies a sense of discomfort and or unfamiliarity. So someone who's so fused to a given feeling or emotional response, to me that suggests that there's actually a lack of intimacy or awareness or comfort with that emotion. Why are we keeping it so close?
Hmm. Could I mean that could that be the same framework for someone who says, "I just want to be happy"?
Definitely.
Yeah.
Yes. What does happy represent? What does unhappiness represent?
Hmm. Yeah, because it's just like they get attached to it, and then they sort of bypass or avoid anything else that might come in because
Right.
they want to feel
Right.
happy.
Saying I just want to feel happy is like saying I just want to live Mondays. What about Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday? It doesn't it just doesn't work.
Yeah. Interesting. Very good. I also wanted to talk to you. I was looking through your Instagram. Again, people should follow you on Instagram. It's every post is fantastic. But I was looking at
Thank
one of your
you.
recent ones on self sabotage, and I thought that was a good topic to talk about.
Mm-hmm.
Because there was about listed about 6 things that might be something to look at when you feel like you self sabotage. So could you just talk about what self sabotage is? It might be self explanatory, but we'll go for it anyways.
Mm-hmm. Sure. So self sabotage is when we consciously or subconsciously interfere with a successful outcome in our lives. We're working hard on achieving a certain goal and we obfuscate or interrupt that process. And there can be many different reasons for why. In a nutshell, I'll do my best to explain them. Hopefully, they coincide with what I wrote on my post. But the first is, our comfort zone. Humans are creatures of habit, and we often will opt for what's comfortable rather than what's best for us. So, stepping outside of our comfort zone can be daunting and uncertain. So, we tend to settle for what feels safe and familiar, even if it means sacrificing our sense of growth or personal fulfillment. So we, again, as human beings, we opt for what's familiar, what's comfortable over what's best for us. And that's really important to know. We're primed for familiar rather than fabulous. So that may be one reason. The other is a fear of failure. It can be a powerful deterrent to pursuing our dreams or taking healthy risks. So we may be afraid of rejection, criticism from others, or experiencing setbacks. So we may settle for fine or good enough rather than striving for excellence. Another could be external validation. And society, as we know, puts very specific markers on what success is. And moving towards something bigger, towards something different, might fall outside of the realm of what society governs as being the right move for us. So staying in that zone of what is customary or what is expected can sometimes be a part of interfering with our process of growth and development and really self sabotaging. Having limited self beliefs
Mm.
and self doubt is something that's really important. It can hinder our confidence. It can prevent us from striving for more, right? We might convince ourselves that we're not capable of something better, leading us to settle for less than what we truly deserve. Also, a lack of clarity and purpose. So many people settle for fine. Many people sabotage plans because they have a lack of a clear purpose or direction in their lives. And so it's really important that we get cognizant and clear on what our vision is, what it looks like to experience personal fulfillment. And the last is complacency. You know, Complacency can set in when we become comfortable with the status quo. And sometimes we may opt for comfort over what's best for us. So self sabotage is sometimes more comfortable than pursuing our greatest achievements and goals. So we become accustomed to our current circumstances and we might lack the motivation or drive to make the necessary changes. So these are some reasons why we might self sabotage.
Yeah. I think of the fear of failure, then I also think of the fear of success.
Mm-hmm. Again,
Cuz that
same coin.
right, it's like, cuz a lot of people will think about doing something that they've never done before, something they know that intrinsically that they want to do, and they're like, "Well, what if it doesn't work out?" But they also say maybe, "Well, what if it does?" And that might scare them even more.
Correct.
And so it's very interesting because I used to be a professional wrestler, and at one point in my life, I wanted to work for WWE. And I'm like, what if it works out? Like, what if I'm this like super famous John Cena-esque WWE champion? And there's a little fear there because that's a lot of pressure and a lot of responsibility. But it also motivated me. But I could see how that could be like, oh, I'm not even going to try now because that's just too much. And I could see how
Mm,
that could be a self-sabotaging act based on your self-limiting beliefs, based on this fear of success, based on you not maybe wanting to put yourself out there. Because what if you do, and then you put yourself out in front of millions of people and you don't do it, but like you still tried? And I think that's just as important as anything else. So
hugely important.
Um, how do you start working with someone who might be having these self-sabotaging beliefs? I know it's very general because you can't specifically talk about an
Mhm.
actual human being that you're helping, but maybe general thoughts on it.
I think it's important to understand the function of those self-sabotaging beliefs, what they're serving, why they're in place, whether they're protective. I think that we tend to engage in behaviors, even ones that are on the surface not so good for us because they serve some type of what we refer to as secondary gain. There's some value associated with it that might be a bit more subsurface than overt. So I would really want to understand the function of living small, living outside of the scope of one's greatest potential, and why that's taking place. I'd want to explore beliefs around success and failure. And I'd also want to have a better sense of self talk and
Mm.
really work on challenging, amplifying, and augmenting ultimately the quality of self monologues that are taking place on a daily basis. And that comes in the form of changing habits.
Yeah, habits, daily habits create your life. But I also imagine that past traumas have a lot to do with how people show up in that way. Just like
Yes.
they they influence how we show up every day. But I imagine
Yeah.
definitely thinking that you don't deserve this, thinking that you should
Yes.
be small and weak and just be left in a corner, and all of this very, very, very hard stuff. But I imagine that plays a huge role.
Huge. For survivors of persistent traumatic experiences, one thing that we see kind of across the board is that individuals who, as an example, have sustained many years of neglect, sexual trauma, they tend to have a foreshortened sense of the future. In other words, a 10-year-old who's undergone significant trauma, a 30-year-old who's undergone significant trauma, tends to anticipate that their life will end a lot sooner than it may actually. They may envision living only until the age of 40 or 50. That tends to be kind of a universal thread of trauma survivorship. And because of that, the executive functioning skills, the planning, the anticipating, the thinking big is something that's not really a luxury that's afforded to trauma survivors in many ways. It becomes purely about survival. And when we're in survival mode, we're not really looking to optimize. We're looking at just remaining steady, staying small, and protecting ourselves from further re traumatization. So you're absolutely right about that. Trauma can unquestionably impact our sense of self and our vision for the future.
It makes me think about addiction because
Mm-hmm.
I've heard many addiction specialists say that the thing that someone got addicted to was actually potentially the thing that saved their life
Mm-hmm.
because they needed that to help them survive instead of considering the other permanent decision. And when they get on this healing journey of trying to recover from this thing, there's a part of them that could say thank you. And
Right.
that allows for some forgiveness to come through. So they're not totally shamed and guilt ridden for that thing that they decided to do. Is that something you believe
Hmm.
to be true also?
I think that substances, other forms of process addiction, whether it's compulsive gambling, compulsive overeating, sex, absolutely serves a solution like quality for many people. I tend to think that most addictions start off as fun, then they become fun with problems, and then problems only.
Mm,
I have a patient who once said, drugs and alcohol gave me wings to fly and then took away the sky. And so,
mm,
absolutely, there's an element of survivorship and kind of an insulation type quality that substances and other forms of dependency can provide and really create a safe harbor for some people who are really experiencing enormous distress and pain until it
yeah,
doesn't work any longer. It's the
right.
greatest form of betrayal.
Hmm. And then we have the greatest motivator for change is pain, and at least it was for me in my
Yes.
life.
Yes.
I've heard some recent interviews or interviews that you've done. It was a motivator for you to get into the work that you're doing. But it's
Definitely.
it's that's so hard to know that like we have to go through something so hard and painful to try and survive one, and to also know that we can change and grow and adapt, and then want to get back into the same work trying to show
Mm.
people how capable that they really are.
It's pretty cool, right? If we can full circle it and come around to that part of pain and optimize differently by giving back to others, by being more vulnerable, by making different decisions that we didn't have the ability to make at earlier iterations of our lives. Because I'm convinced that most folks do the best that they can with the skills that they've got, period.
Yes, I take the Brene Brown route and just assume everyone is doing the best they can. It just makes my life
Yes.
better.
Whether it's true or not.
It
Yeah.
does, like whether it is true or not, it does make my life better, and it
And I
helps
believe it
me
is.
try and understand people more than just being a quick judgmental person, which I've obviously done in my life. I'm not far from perfect, but just having
Yeah.
those sort of things to fall back on to assume someone is doing the best they can, just
Makes a
helps me
huge
out. So
difference.
yeah, I have one last question for you, Dr. Josh.
Sure.
And it's stolen from Tim Ferriss, so I'm not taking credit for this because he's my favorite podcaster. So you may have heard this
Okay.
question before. But if you were to put up a billboard in Los Angeles and millions of people were going to see that billboard every single day, what would you put on
Oh my goodness.
it?
Get out of your own way.
Hmm, nice. Haven't heard that one yet in 165 episodes, so great job.
And I think we can be in our own way by overthinking, by isolating, by making decisions that might fuel our familiar comfort zone, but ultimately not be in our best interest, by not taking risks, by not prioritizing self care, by not reflecting, by not practicing gratitude, by not having, kind of a morning routine, things like that.
Absolutely. Absolutely. Thank you so much for your insight, for your time, for your energy, for everything. I really appreciate this conversation.
Thank you so much. It was an honor to be here. I'm so appreciative as well.
Thank you guys. See you guys next time. Cheers. What's up, everybody? Thank you for tuning into that episode. And if you enjoyed it, click here for another full length episode of the podcast. And please don't forget to subscribe. But above all else, most importantly, please take good care of yourselves and others. And I'll see you next time. Lots of love. Cheers.